In our health news focus today, we look at how access to safe water improves maternal health service at Bondo Health Centre IV in Arua District. The burden of disease attributed to unsafe drinking water, sanitation and hygiene has reduced at Bondo Health Centre IV in Arua District as a result of improved wash facility with support from Swedish government and Unicef. According to the reports, previously the facility was faced with water shortages that affect the quality service delivery, including maternal health. Musa Enzama, the landlord of Bondo Health Centre IV, has highlighted that the long distance covered to look for water has greatly reduced because the people are now accessing the clean water within their homesteads, as in this report.
Facility has been graded to this grade 4, and this water being brought in has helped the community surrounding the facility very much, whereby in the case of being moving up to the river down, so people are just getting clean water within here, which is very helpful to all these people of mine here within, including me who surrounded the facility everywhere. I think that is a very big reward we are getting from this since the facility started from 1942 up to date. There is no complaint, and since the development is going on, we are enjoying it, the benefit or the income of the facility within the area here. What exactly is happening here has brought a development in the area, and it is going on helping the community around here. My appeal to the government now is the government should grade the facility, including the ward for the persons who are coming in, and enlarge the number of the staff's housing within the facility.
Bylaws were also set in place to manage this water point and address the issues of sustainability at the community level, as in this report shared by Tom Lematia.
We have our plans in place to run the activities. One is we have set bylaws to manage the water point, among which includes we have to make monthly contributions to manage the water. In case a household, that is on household base, a household pays around 1,000, it pays 1,000 shillings every month. The collection is done monthly. I think that this is our first month into office, and we've managed to do that. We do that in the interest of minor repairs.
So serves majorly the village of Odrava, but people in Odrava, I think the population is 1,500, consisting of 300 households, and their neighboring villages that also use that water. Before that water was given to us, we used to go and look for water in that stream that flows. There's another spring that is very far, and others. Much as there's a tap in the trading center, but if you don't have money, you cannot access it. And this is very clean water. It has helped the community. Cases of bilharzia and other diseases these days are not registered much, I think, in the facility. We are very grateful for the partners that have given us this water. And for other details, I may call the secretary to come and give more details on how we manage it. Like we mobilize some funds from the communities for maintaining minor repairs and cleaning around, and also some small money for those who look after.
We're thankful to you and the people of Sweden for your generous contribution to the community of West Nile. Water is a very important aspect of infection prevention and control in health facilities, because without water, you cannot wash the floors where somebody has soiled by vomiting. You cannot wash the equipment before you use. You cannot wash your hands, which is the most important preventive measure. So with the help of our partners, they are able to do a borehole, motorized it, connected it to the service delivery points. There's no need for a clinician to walk from his chair outside to wash. You wash within because we have hand washing facilities within, which saves them time, which also improves the quality of care in the facility. So that is something that has really tremendously changed the welfare of the health workers. Then, one other critical area is the labor suit. You know, those who are married or who are women, if you have ever gone to a maternity to deliver, you know what takes place there. And for it we need water. With your support, we now have water in the labor suite where mothers can be served and water is within. Previously, before that, we had the spring boreholes here. One was that side. It was decommissioned, then the other one, which was set off by the community, and it was located in a big trading center at Bondo. So there was issues to do with the availability of water compared to the population. So with this, there is no more problem in the facility because since 2018, this is a facility that is been functioning, and where so long as there's sunshine, there's enough water for the use of the facility. And you know, boreholes frequently break down. When boreholes used to break down, the next alternative would be a stream along here. No more going to the streams for water because the water is available. Now even it has made the life of the people who are supporting cleaning very easy. Instead of fetching water every time from the borehole, the taps are within, you just tap and use. The tenants and the clients that come, they have safe water to drink without any worry. Even the staff quarters, within the staff quarters, there's a tap for them.
The water points, as my DHO had mentioned, we have a lot of entry points. A community water point, there is a standing tap for the staff, then the water is connected to almost all the houses present. The maternity has the lab, which is connected to the OPD, then the OPD consultation room, even in my office. As we speak now, the new project of Dr. Dip also has the theater, has already been connected to the same water. We really appreciate you for that. Then, and in future, we plan that, as my DHO has said, that with even the theater having been fully completed, though without equipment, when we shall receive the equipment, we shall still lack the IP section, the ward. Then we know that with time, when we receive all that, we are going to have to extend this water to the wards as well, and the laboratory. And with time, we know for security purposes, the facility is to be fenced. And when it's fenced, that means the community may not be at ease, or they won't be able to access their water point easily. Meaning we have to extend their water point out of our fence.
According to reports, the facility serves a total population of 31,200 people. Scovin Cheta reporting.